Guys, have you all seen this new Dot pet?
Wow!
So cute, right? Look at the dots, the heart, and the hologram.
Guys, please help me, guys.
Why?
What? Ayo, this morning, right, when I wake up, you know what happened? It comes. God!
From what I know, acne is a common condition that most people have dealt at some point.
Oh.
It's a condition. It's actually a condition that
Mm.
develops in and around the hair follicles and their oil-producing glands, those sebaceous glands. The thing is, we have these glands all over our body and only shows up on our face, our chest, and also our back.
Why? Why though?
Because that's where these glands are the most active. Most people think that, this is like a teen issue, but it can actually start in your 20s or your 30s actually.
Oh, I see. Actually, I just found that there are actually 5 types of acne, which is whitehead, blackhead, hair peel, pustule, and nodules.
Okay, so in Malaysia, to figure out how someone's acne is severe, we use tools like Comprehensive Acne Severity Scale, CAS. This system including types of lesion and groups acne into 4 grades of severity. So the grade 1 to grade 5. Grade 1 is the most almost clear but still have few comedones. So grade 2 is the mildest. It have open comedones and closed comedones, which is blackheads and whiteheads.
Oh.
And grade 3 is the moderate one. It will move up to small red bumps and papules. Grade 4, where you will see pustules, which are inflamed bumps filled with yellowish fluid. While grade 5 is the most severe one. Many pustules clustered together to form large, painful cysts, also called nodus cystic acne. By understanding these grades, dermatologists can recommend treatment that match the severity of the condition by helping the patient to get the best result. So let's talk about the epidemiology, which is studying how disease happen, spread, and impact us. It's like being a detective, figuring out what's causing the problem and how to fix it. A key idea in epidemiology is epidemiological triad. Think of it as a triangle with 3 parts: agent, host, and the environment. These are big players behind any disease. Let's use acne as an example. Our skin is like an island, home to bacteria like Cutibacterium acnes, the agent. Normally, it's harmless, but when pores get clogged with oils and dead skin cells, the bacteria thrive, causing redness, swellings, and pimples. Next, the host. That's us. Things like hormone, genetics, and skin type can make some people more likely to get acne. Finally, there's the environment. Factors like diet, stress, lifestyle. Eating too much sugar or not sleeping well can make acne worse.
So now when we think about public health, we often have to discuss about numbers and statistics. So the prevalence of acne will show us how easily people are actually affected by this. So the 2010 global burden of disease showed us that around 9 out of every 100 people of all ages are currently dealing with acne, making it the 8th most common skin disease in the whole world. Compare this to 7 out of 100 people that deal with eczema, or 3 out of every 100 people that deal with psoriasis. The prevalence becomes even more relevant when I tell you that around 90 out of 100 adolescents and teenagers are currently dealing with acne, and 73 out of 100 people have dealt with acne during any given stage in their lives. For Malaysia specifically, a study showed that 68% of Malaysians aged between 19 to 25 have experienced acne, with 59% of them developing scars in the future. It's also worth noting that women have a substantially higher risk of developing acne, partially due to hormonal imbalances and more frequent use of cosmetic products and makeup. Besides prevalence, we also look at the incidence rate of acne. But for acne, here's a really interesting fact. There isn't really that much good data and research about how often it occurs, and you might wonder why. Well, it's because acne isn't typically reported in the way infectious disease or chronic conditions are. Think about it. How many of us go to the doctor the moment we get a pimple? Not many, right? For most, it's just a part of our lives. But there is an interesting study from China that analyzed data from the global burden of disease during 2019. It revealed that the incidence of acne is the highest during the ages of 10 to 14 for most people.
Yeah, that's one thing we know for sure. Acne loves to make its debut during puberty.
My acne just came in when I was 12.
Yeah, well, it's because puberty is like a hormonal roller coaster. And one of the key players in this ride is androgens, which is a hormone that ramps up oil production. And in fact, most of the risk factors is related to increased oil production, as we know causes acne. So, in this case, individuals who have oily skin, which is typically inherited, are also more likely to develop.
So genetics takes a role.
And it doesn't stop there. Family history matters too. Researchers in Singapore studied over nearly 4,000 people, and they found that if your parent has acne, you are 2.5 times more likely to develop acne as well. But what's more interesting is that if your sibling has acne, your chances jump to over 60%.
Wait, I just thought it's just parents.
Yeah, that's a common perception. But even if your sibling has acne, your chances to develop severe scarring also increases by 5 times.
Wait.
What else?
So what you eat plays a role too. There was a Malaysian case control study, which is a method where researchers compare a group of people with a condition like acne to those without it to see what's different. And the key finding they found was that those that consumed milk at least once a week were 4 times more likely to develop acne.
Stop.
Yeah, it's because milk contains sugar and hormones that ramp up oil production as well. The participants in this study kept detailed food diaries, but they recorded everything they ate over 3 days, and this helped the researchers to establish a link between acne and their diet. However, the connection might depend on factors such as the type of dairy, cultural eating habits, and also the source of the milk. So since it's not the same for everyone, whoever in the audience right now, if you guys are suffering from acne, you should try keeping your own food journal to see whether certain foods, like milk, can affect your skin.
When I have acne, right, I don't really want to take photo. I don't want to go out.
Well, that's actually really common. And in fact, acne doesn't just affect how you look, but also affects how you feel about yourself. In fact, a study in Kuantan studied this exact issue. They used the Cardiff Acne Disability Index, which measures how acne affects our daily life and social confidence, and also the Dermatology Life Quality Index, which focuses on the broader issue of how acne impacts our emotional health. And they found that 40% of the people had moderate challenges, like avoiding social situations and frustrations, but 13.5% had severe challenges which were often linked to anxiety and depression. So you're definitely not alone, and this is something that a lot of people deal with.
Oh, so that's why this is a
Public health issue.
Because this just doesn't affect us on a physical level. It's also a problem with our mental health and our emotional health. And it's also an economic burden because people tend to spend money to get treatments and cosmetics to like hide their acne. So overall, this makes it like a societal pressure and a societal challenge.
Oh, I can feel it.
So I've been managing my skin condition by applying sunscreen and consistent skincare routine. So how else can I treat if it's more severe?
So the prevalence data shows that most acne cases are mild, so treatments like benzoyl peroxide or topical retinoids are affordable and accessible for the majority, as they are available over the counter. This can help kill the acne, causing bacteria, and prevent the build-up of dead skin cells that clog pores, so it reduces breakout occurrences.
Oh, I see. So how can I manage if my acne is moderate or like more severe?
So actually, there is around 15 to 20% acne in adolescent progresses to the moderate or severe stages with a higher risk of long-term complications, including scarring. Although this form of acne is less common, but it is more impactful, often leading to psychological stress and reduced quality of life. That's why early intervention is so crucial. For these cases, systemic treatments are used. One of the most widely used options is oral antibiotics like doxycycline. These treatments work by reducing inflammation and bacterial overgrowth, which are the key drivers of severe acne. As we've discussed, one of the risk factors of acne is the rise of androgen levels during puberty, and this can also be caused by hormonal imbalance and conditions like polycystic ovary syndrome. For these cases, hormonal therapies are highly effective. Birth control pills containing estrogen help lower androgen activity and reduce oil production. And finally, isotretinoin is the gold standard of acne treatment. This systemic retinoid addresses multiple factors including excess oil production, inflammation, and irregular skin cell turnover. Studies indicate that it could reduce the risk of recurrence in up to 70 to 90% of patients. Hence, it is a powerful option, especially when initiated early. However, because of its potential side effects, including sensitivity to sunlight and strict pregnancy precaution, it's reserved for carefully monitored use in severe cases. It is also important to treat acne scar as it can negatively impact the patient's quality of life. For example, by using chemical peels that promote collagen production and enhance skin textures. Studies show that salicylic acid peels has a risk ratio over 2.0. This means patients using salicylic acid are twice as likely to see noticeable improvement compared to other treatments.
Given the high prevalence of acne, why do we still stigmatize it? what step can we take to reduce this stigma?
So part of the problem lies that society still has like very unrealistic beauty standards that is mainly perpetrated by the media, and a lot of people would still believe that acne is like a result of poor hygiene or like bad habits, but in reality that's not the case. So if you want to address this, first of all, our public health efforts should focus on educating people with evidence-based research and data, and we should tell people about what the actual risk factors of acne are, such as hormonal changes or genetics, and through this we can slowly replace misconceptions and give people more time to understand and provide more empathy.
Given the rise in antibiotic resistance, how do we balance using antibiotics for acne with the need to preserve their effectiveness for more serious infections?
So antibiotic resistance is a very serious concern, with prevalence as high as 90% in places like Spain, making antibiotic stewardship crucial. This means limiting use to 3 months and pairing with other treatments like benzoyl peroxide to prevent resistance. Patients should also transition to non-antibiotic therapy to maintain result without risking further resistance. Dermatologists should also assess individual risk factors like hormone imbalance before prescribing antibiotics, as options like spironolactone can treat hormonal acne without contributing to resistance. Finally, we should support research efforts for new antibiotics like sarecycline, which was approved in 2018. Clinical trials have shown that it reduced inflammatory lesion with a favorable safety profiles.
How do we ensure that acne treatment are affordable and accessible, especially for the low-income communities, given how widespread the condition is?
That's a really important point to raise, and even a cross-sectional study in the Philippines found that lower-income patients waited over 4 years to seek for acne treatment compared to higher-income patients that waited just a year. So to make the treatments more affordable for everyone, we should encourage the use of generic medications. Like for example, in India, they have a Jan Aushadhi scheme that already made topical acne treatments more affordable and accessible. So to expand on this and include oral medications, in that way we can make it more accessible to everyone and have a lower cost as well. And we can also use telemedicine to improve access to acne care in rural areas by having virtual diagnostics and follow-ups so that the patients don't have to travel.
If acne affects mental health so profoundly, how can we integrate mental health care into dermatology more effectively?
Dermatologists can start by routinely screening patients for mental health issues using tools like the Dermatology Life Quality Index or Hospital Anxiety and Depression Scale to spot those at risk of anxiety or depression. If the initial screening shows a patient might be struggling emotionally, they can refer to patients to mental health professionals who specialize in treatment like stress management or cognitive behavioral therapy. This collaborative approach ensures both the physical and emotional aspects of acne are addressed.
We are Beyond the Breakout. Thank you for watching.
So here is the references.